In a handful of cases across the United States, morbidly obese children who were at risk of serious health problems were taken away from their parents. A Harvard pediatrics professor and obesity expert thinks that this is a good idea. He says that the benefits that Child Protective Services typically provide, such as in-home social support, parenting training, counseling, and financial assistance, may address the problems of childhood morbid obesity. But if none of this works, he says that foster care is a viable alternative. So the question for today's Stream Team is this: should morbidly obese children be taken from their homes, taken away from their parents? Lisa Bloom is an attorney and the author of Think Straight, Talk for Women to Stay Smart in a Dumbed Down World. Gail Saltz is the Associate Professor of Psychiatry at the New York Presbyterian Hospital. And Dr. Melina Jampoulos is a physician nutrition specialist. Thank you all for coming and being part of the Stream Team today. Lisa, I'd like to start with you. Do you support this recommendation? You think this is a good idea?
If all else fails, yes. Parents are entrusted to protect the health and safety of their children. We wouldn't allow a child in a home that keeps a loaded gun on the table. We don't even like it when parents smoke frequently in the presence of their children. A child morbidly obese means that child is at serious risk of disease or even death because the parents are not able to feed that child properly. They're overfeeding that child. So if the parents can't get that under control via parenting classes or some other less restrictive alternative, the child has to be taken out of that home.
Melina, if getting Child Protective Services involved helped the majority of these kids, these morbidly obese kids, but led to a few being pulled out of the home, do you think the program would be worth it?
Well, I think this is a really complicated question because childhood obesity and obesity in general is so complicated. And there's a genetic component. We know that less than 5% actually have a genetic component, and we're learning more and more about the genes and their interaction with the environment. So it's very, very complicated, and it's a really loaded issue. And I don't think that we've exhausted even remotely any of the societal things that should be in place to address this. But as a last resort, because of the things that Lisa mentioned about the psychiatric impact and the health impact, if all else fails, for the sake of the child, if there is a sign of abuse or neglect from the parent, I would resort to that. But it would be a very, very difficult decision, and I think a lot of different experts would have to be involved to make that call.
Gail, though, I want to ask you, I mean, if you can pull a child out of the home for malnutrition, I mean, a lot of people would say, well, shouldn't you be able to pull them out for morbid obesity as well and return them when they get healthy and when they can get the support that they need at home?
I think the instance of this being a positive is vanishingly rare. There are, of course, going to be bizarre cases, but removing a child from a home is really traumatic. And the idea that you're going to stick a child in a foster home, which often, quite honestly, is not a great environment either, and that's going to keep them from eating, overeating, is frankly an oxymoron. It doesn't even make a lot of sense. There are many factors that lead to childhood obesity, but emotional factors are one of them. So the idea that you're going to traumatize a child who doesn't have the experience at that moment of being abused by taking them away from their family is going to create another cascade of problems. So while I appreciate the fact that morbid obesity can create terrible problems, I think we have to look for other solutions, and I think that it's different from malnutrition in the sense that that is a deprivation. That is a taking away and denying a child. This, in a roundabout way, I guess you could say is, but it's really more of an overdoing it, usually due to lack of education or emotional issues that are going on, like a replacement of love with food, lack of money, and certain things that it seems to me really could be tackled in other ways.
But Melina, I mean, this really does come down in a way to economics. I mean, in a way, isn't this punishing poor people who may not be able to afford healthier, more expensive food, and then you take their children away?
Yes, I think that's an excellent point. I think we have to face the fact that this is much more of an issue in low-income minorities, and that's where the resources need to be focused. And these people often don't have the budget, the time to come home and shop and prepare healthy meals and get exercise for their kids. They're not exercising themselves. They don't have the resources to go to a gym. And if they live in a community where it's not safe to walk, they can't walk it in the evenings with their kids. So I think we need to focus much more on the resources to these type of parents And it is, we cannot just say that these parents have their children taken away because they're not trying hard enough, because it is such a complex disease, obesity, that we cannot just blame the parents. We have to support them and do whatever they can financially and emotionally to get them on the right track for their kids.
All right. We are going to have to leave it there. Lisa, I'm so sorry. I know you wanted to add something in. This is, I mean, I could continue to talk to all of you.
Just want to stick up for foster parents.
Okay. There you go. All right. You got the last word. Thank you all for coming on. Appreciate it. Very important discussion. Thank you.